people, it's your girl Frankie here, and today I am going to be telling you how to pass third semester of nursing school. Yes, that's right, I've been through it, I passed it, so I've learned some. It's some things that I didn't need, it's some things that you definitely need, so I'm gonna go ahead and go through that with you guys. I'm also gonna show you guys, well, you know, pretty much touch on topics of what we actually went through, like the topics that we actually covered in third semester. A lot of nursing schools kind of are the same, but you know, as far as the topics, I'm not sure, but I will go over that with you guys so you can know exactly what did we cover in third semester. And then I will give you tips on how to organize your notes so you can better comprehend the information that you are receiving. So if you want to see all of that, then just keep on watching. All right, guys, so I'm going to discuss what we actually, like the topics that we covered in here. Of course, it's Med-Surg, so I'm just gonna go through this really quickly here. So we covered, I just want to make sure I don't skip anything, but we covered the kidneys and the urinary system, which acute kidney disease, chronic kidney disease, you know, things like urinary incontinence, retention, things like that. We covered the blood and cancer, so you know your anemias and different types of cancers. We did the liver, which is like cirrhosis, and then we also did the biliary system, which is kind of like with your gallbladder and things like that. We did cover the immune system, so that's autoimmune diseases as well, like rheumatoid arthritis and SLE, systematic, like the lupus, basically is lupus. And also we covered HIV and AIDS with that, and this does include like pediatric stuff as well in that. So we also covered the endocrine system, and when I say endocrine, I'm not talking about like diabetes. That's not what we covered that in the second semester. But what I'm saying for endocrine system is that we covered like hyper and hypothyroidism, Addison's disease, Cushing's disease. That's the type of stuff I'm talking about that we covered. We did not cover diabetes. I got glue. Sorry. My baby was doing like an art project. I was letting her be creative, and I got glue all like on me. GI, we covered GI. And GI was a very lengthy subject, okay? Because not only did we cover adult GI like GERD and things like that, but we also covered kids, so appendicitis, which is crazy because I actually have like kind of like a little map I made of all the different areas of GI we talked about. So appendicitis, we got irritable bowel disease, we have hernias, peritonitis, diverticulitis and diverticulosis, and we also talked about irritable bowel syndrome and irritable bowel disease are two different things. So we covered a lot, and also I tried to kind of make it to where like, oh, this is just for the upper GI, you know what I'm saying? So this is like upper GI, and then I put it in categories of what was part of the upper GI, basically. So there's a way that you can, you know, do that. And then after GI, we covered mental health. Now, mental health was a little bit different. It wasn't the regular smegular like Med-Surg that we're used to. Mental health is more so of therapeutic communications, medications that you give them, and their the effects of the medication, adverse reactions, things like that. Like, you know, like it was more so of, like I said, therapeutic communication more than anything. So yeah, so that was a little different. So I'm telling you guys, we went over that just so you can be prepared, but it's not on the same, like it's not along the same as precisely like this stuff. I don't even know how to say it. But anyway, so some tips that I have, which I just kind of showed you guys, is to kind of plan it out in your head to make it make sense to you. And that's kind of what I had to do. So in order to make GI make sense to me, because there was so many different GI, you know, gastrointestinal diseases that I had to kind of categorize them myself. So we have upper GI, we have lower GI, we have pediatric GI. So I kind of just made it to where it made sense to me. So that's a tip that you could definitely do. If you have one thing like irritable bowel disease, but it goes into 2 different categories, and then I just split it pretty much down the middle of the page, and I have one side belonging to one thing and then the other side to the other, so I can like quickly look at it as a reference, and I can see what drug therapy it gets, what's the signs and symptoms, you know, because there's very similar but different. So that is one thing. I do have a video on different studying techniques for you guys, so I will put that video down below because I don't want to spend too much time on that because I do want to get to organizing the notes. But you see I made this cute little kind of like flip studying thing. This is in the video as well. But yeah, so let me get to my tips. I actually wrote them down, so I'm gonna put this up. So if you haven't got one, I suggest you. It's a lot of information for nursing school, and I just do it by whatever the test is going to be over. I separate it by test, and then I just put whatever I made notes flat, like the note cards. If you do a concept map, if you do a drug card, whatever it is for that particular thing, I put it in that section. So when I'm studying, you know, I can just go there and pull out everything that I did. You can print out your PowerPoints, put those in there as well when you're done. And then, you know, so when finals come, you can just pull this out and then go over your weakest points and go from there. But I'm gonna put this down. Okay, so I wrote it kind of down in the order just so I won't be rambling too much. Because sometimes, you know, you can get to talking and just keep talking. So when it comes to organizing your notes, you want to kind of go in this order. And this is just a blueprint for you guys. So if you have trouble with kind of getting your thoughts together, kind of how to organize your notes, if you've been struggling on understanding what's going on or just grasping the concept, well, I have some steps here of how to organize your notes, like in order, and you guys can give it a try. If this is already how you kind of organize your notes, then comment that down below. If you try it after this video, I still want you to come back to this video and comment it down below if it did help indeed for you to understand the concept. Because really, you can write this stuff down, but you need to know how to apply it. But this is a good kind of standing point for you, so you will know. You know what I'm saying? So I'm just gonna go through it for you guys really quickly here on how I organize my notes when I am taking notes. And I have also learned to handwrite my notes. Why? Because it just sticks with me a little bit better compared to if I just type it up, because eventually I'm just going in autopilot like typing. So if you can type without looking at the keyboard and all that stuff, then you might want to take a step back and actually write out your notes. It's time consuming, but you will remember it a little bit better to me, but everybody learns differently. But I've learned to like kind of write stuff out. So when it comes to organizing your notes, one, you want to have your topic or the disease or whatever it is you're talking about. In this case, I'm talking about the disease. So we could talk about cancer, or, you know, something like a GI disorder, or, you know, something like that. And so one topic. Two, you want the patho. Okay, you want to know what causes this disease. You don't have to be long-handed on this, okay? You want to make it short because they don't ask a lot of questions about patho, to be honest. But it's good to know just in case you run into a problem where you have to dissect the question, and then they can kind of help you like, okay, well, I know with this disease, you know, this is kind of like the history of it. You know what I'm saying? So it's good to know. Within the patho, you do want to write down the modifiable and non-modifiable risk factors. You know what I'm saying? I'm sorry, I couldn't even think of that. So you want to write down the modifiable and non-modifiable risk factors. What I mean by that, non-modifiable is basically something that they cannot change. So age, sex, race, family history, predisposal of family history, things like that. Like, okay, that's just part of their genetic makeup, right? The modifiable risk factors, or like if they smoke, if they're obese, you know, if they have high cholesterol, those are things that they can work on to lower or to fix. If they have hypertension, You know, those are things that can be fixed with diet and exercise and things like that, okay? Now, once you have that, you want to go to your signs and symptoms. What is your patient going to present with? What are they going to look like when they come to you? What type of complaints are they going to have when they come to you? Just so you can know, like, okay, this person say they have difficulty breathing, you know, they are, you know, their lungs sound like this, then you will be able to kind of pin out like what could possibly be going on with them. Once you do your signs and symptoms, you want to go to diagnostic studies or diagnostic tests. So what type of tests are we going to do on this person to indeed say that they have this? What are some things that we're going to draw blood? Are we going to do a CT scan? You know, just, are we going to do an EKG? Like, what type of diagnostic studies are going to be done? Once you do your diagnostic studies, then you want to go to your treatment. So once we have pinpointed what they have, then what type of treatment are we going to do? Are we going to give them just medication and send them home? Or are they going to get some type of surgery in order to correct the problem? If they do need surgery, this is the next point. Then you want to know the pre and post-op teaching and what nursing actions and interventions that you need to do. So if they need to get a cardiac cath, or if they need to get like some type of GI endoscopy or something like that, then you need to know, one, what are you teaching your patient before they go into surgery? You need to know what you need to do in order to prep your patient. Also, during surgery, you need to know what you need to be looking for. What do you need to monitor as far as like vital signs and stuff like that. If it's a heart thing, then you want to be looking at the EKG or whatever they have them hooked up to, like the heart monitor. Then you want to know about post-op. So when they get out of surgery, what are you going to be looking for in order to alert the surgeon if there's a complication? Also, what is normal, you know, when they get out of surgery? You need to know that. And then also you need to know as far as teaching, like cough, deep breathe, turning, that stuff you teach pre-op and you still go through it post-op, okay? And once you get done with that, then you want to go to actual patient teaching. So when they go home, ambulatory care, I think that's what it's called. But when they go home, then you need to teach them ways to take care of themselves, what medications they need to, you know, about your medications, side effects, things like that. So that is kind of like my list of a good order to write your notes in order to understand the process, because if you could just walk through that in your mind, then you would most likely understand the concept. You know what I'm saying? Like, so when you see it on the test, you'll be like, okay, let me walk this out through my mind. You know what I'm saying? Or, you know, so it just helps a lot to just kind of have your notes organized. I feel like me, I used to just kind of write random, like just be writing stuff in no particular order. But then once I realized, like, wait a minute, okay, when this patient comes to me, first, what is the disease? Second, what are they going to present with? You know what I'm saying? What are they going to look like? Third, okay, are we going to do a test on them? Like, what type of test we going to do on them? Fourth, then you want to see treatment. What type of treatment are we going to give this patient? So, I mean, are we just going to give them some high blood pressure medication, or are we going to take them to some type of surgery? And then what's the type of surgeries that are options for this particular disease? And then once you do that, then you say, okay, well, this person needs surgery. So now this is the surgery of choice that they have chosen. So what am I going to teach my patient? What do I need to know for pre and post-op? For, you know, when they have this surgery, do they need to be NPO, like, or can they drink clear liquids up to 4 hours before surgery? Do they need a bowel cleansing, enema, or like, what do they need? You know what I'm saying? So after that, then you want to talk about going home. Okay, this is what you need when you go home. This is the teaching. You know, don't lift heavy objects. You know, no driving for 2 weeks. Things like that, you know. So that should be a good basis for you guys. Hopefully you understood that. Hopefully it was easy to follow, because I know sometimes it can be very, very complicated. But during Med-Surg, like, a lot of these diseases and disorders, they all pretty much have this layout, you know what I'm saying? So it's best to kind of know, and if you need to separate them. Like I said, I did a lot of concept maps. Like, I had to visually see it for me to get it. Yeah, you can write it on a piece of paper just straight down, but sometimes you got to make boxes and squares and triangles and stars, and you know, like, just make it to your own liking, to where it's appeasing to you, to where you can understand it. But yeah, so that's kind of the tips that I have in order to pass third semester. Of course, if you do not understand something, or if you're just really confused about a concept, then talk to your teacher, because I feel like they are the best resource, because they're the ones giving the test. But, you know, keep in mind, teachers, you know, they make their own questions a lot of the times, and sometimes it's just like that. Like I said, I talked in previous videos about the teacher I had, and you know, her test was just crazy, but she used to write for NCLEX, so her level of thinking, I felt like, was just, you know, a little too much at times. But if you can kind of grasp this list, like on how to organize your notes, then it shouldn't be too difficult to pass. But yeah, you have to study. So if you are working like 50 hours a week, 60 hours a week, and you think you're finna go to nursing school, like, you have to think about that as well, because I know people that's done it, and it's difficult, it's a struggle, you know, because that's less time you have to actually sit down and study. But hey, people need to make money, people need to pay their bills, so I understand. But yeah, so just kind of do this. If it works, let me know. If it helps you to understand and to process what is going on with that disorder or the disease, comment that down below, y'all. And then also put down your tips, or how you organize your notes, or methods that you use, so we can help other nursing students, because that is what this is all about. All of us want to succeed and be successful and be done, because nursing school is a headache, okay? But it is very crucial to know the information. So that is pretty much all I have for you guys. I hope I didn't forget anything. But other than that, definitely subscribe, comment, share this video, and give me a big thumbs up if you enjoyed it. And y'all already know, I will see you guys in the next video. Peace.